When I think about Dr. Gilmore, or Ed as I generally call him, I think about somebody who's a dear friend, somebody who's been a mentor to me for many, many years, and to the organization, somebody who exemplifies our values. So we look at teamwork, we look at respect, integrity, compassion, community. He just is one of those people that seems to have been born to exemplify those values.
There's such a warmth in him and a immediate ability to share a personal and emotional feeling about something.
I was 12 and came over in the ambulance from school because I was having heart problems and came into the emergency room. They wheeled me in there and he's got that big smile and that big bow tie, and I will never forget seeing him. And it just made me feel like, okay, everything's gonna be okay. He's just so calming, you know? He's a sweet man.
It didn't matter what was going on. He was the calming influence.
The other thing about Dr. Gilmore that I think any of his patients would say right up front is what a compassionate man he is. Just a real genuine person and a gentleman. He just, you know, he has a love of humanity.
Well, he's a family man. He loved his wife dearly and his children, and he wanted to make sure that I knew how important that was. When I first started here, I have 2 young children, and one of the first things that I remember more than anything that he said to me was, your children and your family should be your priority. This job can be consuming, and don't work too much. Make sure that you make them a priority while they're young. And I think that'll stick with me forever.
The students universally love Dr. Gilmore. They just feel that he's this wonderful sort of, I know it's a trite to say, but father figure who was watching out over them and making sure that they were having the experience that was promised.
He's kind, compassionate. He truly cares about his patients. He's always putting his patients first.
Well, he's short. He wears bow ties. He's kind of like a Father Christmas figure, you know, kind of a sort of a short and jovial, little bit of a roly-poly guy. Sorry, Ed, but.
Well, he always had a smile on his face, usually. And he always was very nice to talk to, and they would feel comfortable with him no matter what he was doing. You just would feel comfortable. He was kind of lovable in a way.
Just seeing him, it would brighten up your day. You just look at him and he'd have that big smile on his face and you'd automatically start smiling.
As he has approached his retirement, it's been difficult for him to accept all the praises that have been sent his way, yet I'm sure he's only received half of what he deserves.
I'm going to miss that wisdom that Ed brought to this community. And it's wisdom that comes from years and years of experience and years of knowledge of people and people in general, and the willingness to know people in particular.
He really was, in many respects, the ultimate family physician in the sense of having had this very broad and prestigious training, but coming to a small Maine community to serve the community, which he did, of course, as I say, for almost 50 years. It's a remarkable thing.
He was always looking for a balance between what is, progressive and new and technologically advanced, but not losing sight of the fundamental art of medicine.
He is a throwback to the old days. He's a doctor's doctor. He cares deeply about his patient. He knows them well, both as people and as patients. He tries to do everything he can to get them feeling better and doing well over the long term, and he's there for them.
Ed Gilmore is a wonderful blend of medical training and years of experience, and yet a natural-born compassion.
He had a special, sincere dedication to his patients. It was like they were his only patient.
He put all the patients and their family as an important thing. He's been my daughter's doctor since she was young because she had a genetic disorder.
Dr. Gilmore became my doctor when I was a child, which he does not take on children as patients. He was all an adult closed practice, but he was the only doctor in the area that knew about my genetic disorder. And he actually changed my entire life. He made it so I could be a normal teenager, do normal things, go to college, everything. So he absolutely, completely changed my life.
Dr. Gilmore, I am going to miss you so very much.
I really appreciate the chance to have worked with you my whole career thus far.
We really miss you, and we wish you good luck in your future. And
I just want to say, you better stay out of trouble, Dr. Gilmore, because we will have to take care of you if you don't.
And you know where we are.
You've been a good colleague, a friend, and a mentor to me for many, many years. I can't tell you how much I appreciate that.
Dr. Gilmore, it's been an honor and a privilege working with you and serving our community.
Dr. Gilmore, I want to thank you for all the support that you gave me as I started here as a new provider, and all the time that you are here. You're irreplaceable, and we're all going to miss you dearly.
Congratulations, Ed. You've earned every minute of your retirement. Have a wonderful time. Enjoy as much as you can. Get out and about. And we'll be seeing you for some drinks and some dinner.
I wish you the best time in retirement, and I'm sure you'll still be around to check up on us from time to time, and I very much look forward to that.
I really enjoyed working with you all these years, and I felt you were always a friend as well, and co-worker, as well as our medical director.
At this point in your life, you're able to do any damn thing you please, to say any damn thing you want.
Do not let any grass grow under your feet. Go dancing, because that was always fun dancing with you.
So, Dr. Gilmore, I know that you've earned your retirement, but here's a plea from at least one Confederate: don't do it. We're going to miss you a great deal.
All right, Dr. Gilmore, you're going to make me lose a bet. I bet that you'd be bored and be back to work in a month. So I'm losing $20 now. Hurry up and get back to work so I don't look crazy.
Get your butt back to work.
Thank you for everything that you've done, and I'm sure our community thanks you, because we certainly owe you a tremendous debt of gratitude. You're my hero.
I'm going to miss the wisdom, the advice, the camaraderie that you brought to this hospital and these practices every day. I hope you enjoy yourself, and I hope you still make yourself available, because I'm going to need some advice as life goes on. And thanks.
Dr. Gilmore, I want to thank you so much for the 47 years of service that you've given to our community, to our hospital organization, and to all of the colleagues that you've worked with, because you've been a beacon for providing the highest quality service and the highest quality care at all times in our community. And for that, we are eternally grateful.
Dr. Gilmore, from your family at Cooper Gilmore Health Center, we wish you all the best in your retirement and your travels.
Just remember, you always have a home here at 17 Hancock Street.
And the coffee pot is on.
Bathrooms optional.